Hello everyone, welcome back to Meet the Member series. Today we have with us Aritium. Hello.
Hello.
So please, could you introduce yourself and tell us what your company does?
Yes, well, thank you very much for giving us the opportunity of being here today. So I'm Ángel Colao, so I'm a telecommunications engineer with more than 10 years of experience on different projects, but always combining healthcare and technology. And since 2021, I'm the co-founder and CEO of Aritium. Yes.
Sounds really good.
Well, talking a little bit about Aritium. So, well, I would like to start with the why of Aritium. So, at the end, we are, say, the team, the co-founders. So, we are concerned about the future of our health systems. So, we are seeing currently hospitals and healthcare organizations are facing a very challenging future, driven by a combination of increased demand of health services and scarcity of resources, for example, in terms of human resources. So we know that there are scarce or a lack of medical doctors, nurses, and so on. But even with that combination, we see facts like, for example, this is based on a study in a hospital in Switzerland, that nurses spend less than 1/3 of their time in tasks directly related with having contact with patients. There are a lot of manual documentation, administrative tasks that prevent them to spend time doing what they do best. At the end is taking care of the patients. And in Aritium, we think that it's possible to change that. And for that reason, we develop solutions to automate different processes and tasks in the hospitals or health organizations by combining the Internet of Things, the IoT, and the artificial intelligence, the data science. At the end, we do that in our platform. It's the Aritium platform. And we are, at the end, the core of our business. And we are working on solutions from, for example, systems to automate the task related with ancillary services like cleaning or maintenance, to other solutions, for example, to automate the monitoring of vital signs of patients in the hospitalization area by leveraging a wearable device and integrating the data seamlessly in the electronic health records. At the end, we are working on different initiatives with the idea of making smarter hospitals or health organizations.
Let me ask you, what makes your company stand out from the others?
Okay, I would like to point out maybe the IoT, the Internet of Things technology that we are applying. Let's say that historically, most of the initiatives of IoT initiatives, not only in healthcare but also in other industries, they were based on trying to leverage already available technologies, like Bluetooth, like Wi-Fi, like cellular technologies that were thought and developed for other purposes, not specifically for what we think about the current concept of Internet of Things. We have seen also in the last years the development of more specific technologies, like that are called LP1 technologies, low power wide area network, that at the end are trying to mitigate some limitations of the available technologies in terms of range of communication, in terms of battery consumption, in terms of affordability of the devices. And among all these technologies, we are really excited about the opportunities that the LoRaWAN technology can offer, especially at the end an open standard, an open technology that allow us to deploy private IoT networks in hospitals or healthcare organizations that at the end not only allow us to meet the concerns in terms of data management from the healthcare or hospital managers, but also once you have this private IoT network, it's very easy to scale in terms of devices, in terms of use cases to cover. And on the other hand, this technology also has, as it is open, it allows you to have a flexible architecture, so you can play with the different elements. And this has allowed us to develop a specific component, that is what we call the Aritium Hospital Hub, that at the end, it's a piece of software that you can deploy on premise in the hospital infrastructure and can manage all the IoT messaging and can integrate this data into the hospital information system, to the operational systems, using common IT standards like HR72 or FHIR, that are the ones that are using in healthcare. No? At the end, let's say that applying this technology, we are able to make pretty easily any hospital an IoT-ready one.
Sounds great. What has been your company's biggest success or failure?
Okay, so well, let's just start with the failure. I think that at the beginning we were thinking about having a broad approach. No, at the end, as we are working with Internet of Things, artificial intelligence, and all the data science, at the end, these are technologies that can impact an area, impacting almost any industry, no? From smart buildings, smart agriculture, smart industry. So when we were thinking about initially in the company, so we thought, okay, maybe it's good to have a broad approach because, for example, for your business plan, it's very good that you have broad total addressable market and things like that. But then when you start trying to go to the market with this approach, you see that, well, it's difficult to convince people when you have a broad approach. And especially at the end, you are competing directly with big technological companies that for sure they have more resources, they have more capabilities. And it's, in our case, it was like a failure that we needed to try to pivot and try to, okay, let's try to focus where we really have experience, where we have something different to offer. This being trying to go to the healthcare sector, no? And talking about the success, I think that the best thing that we have done so far is try to apply an approach of co-creation. No, I think that once you launch a company, it's very easy to think about, okay, I'm going to develop a solution, and once it's ready, I'm going to bring it to the market and try to convince customers to use it. And the reality is that that is very difficult. Sometimes what you think that is what the market is going to want, that's not the reality. So from our side, we tried since the beginning to work directly with our customers or with our partners, no, and developing these solutions from scratch, going out of the building and going to the hospitals, to the healthcare organizations, to talk with the final users and to see how or what are the use cases that are relevant for them and how we can apply our technology to improve that. No? So that's what I think that is so biggest success.
Absolutely. What made you join Barcelona Health Hub?
Well, at the end, thinking about that we really believe in this approach of co-creation, of being close to the customers, to the end users, and to the industry. At the end, Barcelona Health Hub is a reference in this sense, no? In creating these spaces of where you can exchange ideas, you can identify partners to talk with them. You have hospitals, you have big medtech companies, pharmas. So for us, it's very, very good and very interesting to be in this kind of ecosystem because you can be exposed to all these new ideas. You can really see what is relevant for the companies, for the market, for the end users. And that was the key objective for us when joining Barcelona Health Hub.
And what do you expect from Barcelona Health Hub towards the future?
Well, really, I expect to keep working on this on this objective of creating these spaces of where we can share experiences, ideas, and especially think that you can play a very relevant role on facilitating, especially for startups and for hospitals or healthcare organizations to how to facilitate the adoption of our technology. Let's say that at the end, as a society, we need to be able to drive all this technological development into the healthcare sector, because we want to keep the quality, the accessibility, and to do so, we need to apply technology, and currently, especially for small companies, for startups, sometimes it's difficult to really test your technology, to find the hospital where you can do a pilot and so on. And I think, for example, initiatives like your clinical validation accelerator. So I really think that is very powerful, and I expect that you can keep creating these spaces and facilitating the adoption of technology in the sector.
Is there anything else you'd like to tell us that we haven't asked you?
No, just to say thank you for the opportunity and for all the initiatives carried out. Well, happy to be with you today.
Thank you so much for your time and for this interview. Nice to talk to you.
You.
Bye.
Thank you. Bye bye.